Thank you, Natalia. It's a pleasure. It's kind of nostalgic in a way for me to be back in your presence, and I thank you for inviting me to participate. For those of you who perhaps don't know, I am actually one of the founding commissioners of CCHI, and I am so proud of that experience. I think I was invited in because I was in business. I'm one of those rare American women that happen to be truly trilingual, but I am not an interpreter. I am not a translator. I'm just simply someone who's blessed with language and passionate about language. And I used it by going into entrepreneurship and building companies and working with people in companies, and have always felt a tremendous drive towards raising the professional bar for all of us. In my eyes, you guys as interpreters are miracle makers. You're incredible. I think of myself with my skills, my language skills, and thinking, if I was an interpreter, I'd be thinking, now let me see. I don't think that's how I would say that. No. I don't agree with that point anyway. I would be impossible as an interpreter. So I value you, I'm impressed with you, and I'm very, very keen, devoting my professional life to ensuring your professional status in our country. And it's not been easy. And I thank you. I thank you from the bottom of my heart, all of you, everybody who's on the call in this webinar, and especially these super duper current commissioners. Thank you. I think I'd like to start by just maybe having Vonessa, if you'd give us a word or two about who you are and why you care about language.
Sure. My name is Vonessa Costa. I'm one of the newer CCHI commissioners, having started in October. I have been in the language access field for over 20 years. I'm a heritage speaker of Portuguese. I was trained as a medical and legal interpreter at Bentley College in the first graduating class of Portuguese interpreters in 1999. And I've spent my entire career as an interpreter, as an administrator of language services, a stint as a trainer, and now as an advocate in the commissioner role.
Wonderful. Congratulations. I mean, I think it's so fantastic. I should have mentioned that my languages are English and Spanish and French. The Spanish and the English came at birth. I'm blessed with parents that were wise enough to go overseas with aviation. And so I didn't know. I thought everybody was multilingual. And I took the French the hard way, learned that the hard way. So Portuguese is super cool. So thank you, Vonessa. And Idoli, you said you were from Guatemala, which was one of the countries I spent some time in as a girl. Tell us more. Oh, we can't hear you. Oh, can't hear you.
All right, beauty of technology. So I'm back on. Yeah, so I was born and raised in Guatemala. So half of my life has been out overseas and half here in the US. And just like Vonessa, I kind of got pulled into the language access piece because of the gift of languages, but really kind of became my my reason for life, I guess, in a professional healthcare field. And that's how it kind of things got started. And I think there's so much work to do. And I think 2020 and obviously 2021 is already showing how much we need to get together and work. So I just love this type of conversations because we can look into 2021 and put our minds together and be able to really kind of draw what CCHI can do for everyone that's listening on this call today or watching us. And so we always love to hear the feedback. And I know right now you're probably only hearing us, but by all means, feel free to put notes in the chat. And I think Natalia is watching it. And whatever we didn't get to, we would love to get later. And Danilo's back. So I know you were on, but we couldn't see you. So
right on time, Danilo. Please tell us a little bit about yourself.
So I quickly dug up another webcam that I had here and I plugged it in, and it's much more clear because before it was very pixelated. Okay, so my name's Danilo Formolo. I'm the Assistant Vice President of Language Access for Atrium Health. We're a very large healthcare system here based in the Southeast. I'm based in Charlotte, North Carolina. And as far as my background, I've been in the language access field for over 16 years. It's been a tremendous blessing to lead one of the really most robust language access programs in the country. As far as my ethnic background, my dad's Italian, my mother's Colombian, and they were introduced by a mutual Egyptian friend. Originally born in Edison, New Jersey, but grew up here in the South. So I'll say y'all every now and then. I can talk with a Southern drawl just like the rest of them. So languages spoken are English and Spanish. My wife and I have 2 young boys, ages 6 and 8, who do school from home for now. And as far as personally, I believe it or not, I am an organist. Like I can play the church organ, believe it or not, and I enjoy doing weddings and different things like that. So I'm really happy to be here with you guys today.
Well, that is just grand. I think our stories are always so enriching because we still are relatively invisible to most of this country. And so every time I participate in a meeting like this, I think, oh my gosh, why doesn't everybody in the United States of America know about us and our professions and our passion? So I think that an event like this is good because we get to share and spread the word that, hey, you know, language is really important. It's a gift and we need to share it. So I think that Natalia, you know, she's an amazing individual, and she is she says I'm her mentor, but actually she's my boss. So she told me that we're going to be working on goals, and I'm very big about goals. And I'm going to start with a couple of my goals for 2021, and this will really show you how I can think really macro and really the opposite of macro. So one of my immediate goals at the beginning of every year is to reset my passwords. What about yours, Idoli? What's your first?
No, I think it's just kind of give myself kudos on the back for whatever happened the previous year and what's about to happen the next year. Is just kind of really looking at it very positively and always trying to find the silver lining. And I know it's been very hard for a lot of us to do that, but that's kind of my first thing is just give myself some grace, some words of encouragement, and really look at what I can do, what I've done, and how far I can go. And just kind of just trying to do that, a lot of that self-talk and meditation to be able to go at it with all the strength and all the energy and all the positivity that I can. I think that's kind of my number one thing to do.
Well, that's pretty cool. And you know, this password thing, it's become an annual event for me because I think we should have standards in websites as to where you go to change your password. Every doggone one, you have to look and see, well, where, oh, here it is, change your password. So it becomes like, oh no, Kathleen's changing her passwords, don't talk to her, right? At least the first week of the year. Vonessa, what's your first goal?
So, you know, I've been on campus every day since the beginning of the pandemic. But of course, on campus, we're physically distanced. We spend a lot of time in front of screens and cameras. So I have very simple goals for 2021. I want to stand up at least once an hour. And my watch is going to remind me of when to do that. The other thing is I want to have lunch at lunchtime. And, you know, goals are a destination. And, you know, we map out the path to take one step at a time. They're a guide in our process. I haven't been able to do that every day since January 1st, but I'm trying. And it's going to get me to where I want to be in terms of my own wellness. You know, as we live this life on Google Meet and Zoom and other platforms.
Oh, it's so important. I mean, if we don't have personal stamina and health, we can't do what we have to do. So that's a good one. Danilo, what about you?
So when I look at how I set my goals for the year, I look at 3 main attributes. One of them being the self and the personal circle, which would be my family and I. Okay, that's one. The other one is the organization, of course, my professional life and my job. And the third one being the community. How can my goals personally and professionally impact the community? One of the personal goals that I had for my family and I was really to move to a different home.
Mhm.
We've gotten to the point where we've outgrown our space, and for different reasons, we want to be in a different community. Well, we were thinking, maybe summertime, we'll start quickly, slowly but surely, getting the home here ready to put on the market. And then my wife came across this home, and she said, "I love it. It's a for sale by owner. It's a couple that's downsizing. I want to go see it." Of course,
Oh,
immediately I say, "Oh no, honey, we don't need a house that size or whatever." But it was like a for sale by owner, and so they were able to offer a really, really great price. And there were offers. They got so many offers even higher than what we offered for the home.
amazing.
But they wanted to sell to the right family, and so they told us, "You got the house."
Oh, you're the right
So yes. And so very happy. And so I guess that goal is now translating into transitioning into that new home.
That is so cool.
We're very excited.
Congratulations.
I bet
Thank
you they
you.
were looking for a multicultural family.
Probably so. I
For
guess
sure.
yeah. I
No,
guess
they were
my
looking
boys,
for an organist. They need
An
an organist.
organist.
yeah, they need a musician. Yeah, because yeah, that's what it was.
Organist, of course.
And I think that's, that's such a neat thing, Danilo, because I think that when you have that goal in mind and it's has been set and it's meant to happen, it will happen. And I think that's for the audience listening. I know that a lot of people are concerned now with, the way that things have been in the world for, for goals. Is like, I had all this for 2020 and nothing could happen. It was out of my control. But I think that people just need to remind themselves that if the goal is there, if it's in writing, right, if you have it, if you self-proclaim it, if you keep at it, eventually it will happen. And like you said, your house was just like, it was meant to be. So congratulations for that.
Thank you, thank you. And now it's just find the right buyer. And my wife said that. She says you gotta put it out there to God, put it out there to the universe, and and it'll happen. And of course, then my cousin sent me a little Saint Joseph statue to bury in your yard, because there's that saying that if you bury a Saint Joseph statue in your yard, your home will sell. So I'm like, hey,
Go
we'll
for it.
take all the help we can get.
Go for it. Well,
Yeah.
I didn't think of it as a goal, but it must have been something that I really wanted. I have two splendid granddaughters, and one is studying Spanish and one is studying French, of course. So my communication with my older one that's studying Spanish has been just very satisfactory. It's fine. But my youngest one, I couldn't find. I was trying all, and of course we're all separated. They're up in Montana. We haven't seen them. We didn't go there for Christmas, so I'm really frustrated. And so I tried all these different things, WhatsApp and blah 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 blah. And then all of a sudden, 2 weeks ago, I get this email from her. Her name is Susan, and she says, "Grand-mère." I'm going, oh my God, this is so exciting. This is like the new house, right? And she wanted to, she said, "I would like to spend 30 minutes a week with you speaking French." And she said, "I will send you a Google Meet." It's like a miracle. So for the last 4 weeks, she and I have been meeting, and we speak French for 30 minutes, and it's like such a gift. It's so incredible. So not a house, but certainly language related, and certainly a wonderful, I guess, good thing about this COVID stuff is we're communicating this way instead of being able to go see people. Well, what about professional goals? Should we switch over to some professional goals? Maybe Idoli, you'd like to lead us in that?
Yeah, just thinking about what Danilo had just said about, the community, the self, and the organization. I think that I am blessed enough to be able part of the CCHI family for, 5 and more years, and it really has been kind of the blessing of a community for me, because it really kind of encompasses everything that I believe into. And when you work in language, it really it really is an opportunity for you to grow as a human being and be able to interact and expose with so many communities and so much diversity from within. And so the way I see this is, professionally speaking, we have an opportunity to really be innovative and come look at this from a wide perspective, right? I think that a lot of us prior to 2020, we were seeing things maybe perhaps a little bit narrow because of of the way that, we did business, right? And the way we offer services. So when you think about putting it all together, I think that my professional goals align a lot with what CCHI is trying to do. And that's why I belong to this organization. And I truly believe that the organization mission, the values, and what all of our passion comes together and provides to the community the professionalism that interpreters need to have to be able to meet patient safety and the services that our people and our communities deserve. But on top of that, it really is an opportunity to bring back to the community, because CCHI does a lot like this type of events and other CEUs and networking and you name it. So for me, is my professional goals really align with CCHI. And what I would like to do in 2021 is raise the level of the profession further. I would love for the time where all of our interpreters can be certified and they can be treated as such. And when I say that, I mean professionally and also pay-wise, right? So it'd be
Yes.
really nice that that is recognized and that we can have the same requirements, the same credentials, and expect that level of service that you have from any certified interpreter, regardless of the language, whether it's spoken, sign language, languages of lesser diffusion, common languages. So I think that's where I want to leave my message, that we want to see more interpreters certified, and that's what CCHI is here for. We have so many different opportunities for people to get certified this year. We have our CoreCHI online testing available so people can do it from the comfort of their home. So we're here to do whatever we can. And so I think that my professional goals just go 100% with CCHI and with amazing people like you guys supporting and joining and really getting the word out there. We're here to help interpreters get certified. So that's kind of what I'm going to say for that.
Well, I think Natalia, you should just send Italy out on the road, get her going.
And you mentioned the word innovation, and the one thing that we need to keep in mind is innovation does not necessarily equal technology. It's really all about doing something differently. We've experienced, obviously 2020 is just like a year that to me is, we'll just pretend that it didn't exist. But really, it was all about innovation and doing things differently and having a big shift in the way we conduct our business in our professional lives and our personal lives too. And if you don't mind, if you don't mind, I'll segue a little bit into some professional goals.
Yeah.
Obviously, I could, go into, we as leaders, we all lead pretty good sized language access programs here. Those of us who are panelists. And we don't necessarily need to take you through a goal setting session of what our goals might be, but one of the things, and hear me out here, that I really want to step up is truly having a true, robust, bilingual employee strategy. Now, you may say, yeah, we have them. Yeah, we have. And Vonessa, where you are, a lot of the pages, you have probably the highest percentage of LEPs where you are, especially
43% of our patient
in the
population.
community that you serve. I see you posting things about that on LinkedIn and Facebook all the time, which I adore those things. But we might say, okay, yeah, we're going to, and many healthcare systems out there might say, oh, we have that already, Danilo. You're preaching to the choir. You have a nurse, he or she speaks Spanish, you're going to pay them 5% more. Fine. No, but it goes way beyond that. We need to be enhancing the care experience, and we need to be communicating with our patients in a way that they can understand. And that does not necessarily mean adding a bunch of interpreters, because what ends up happening when you continue to add interpreters is we are always playing catch up. You're never going to have enough interpreters, right? Vonessa, Italy, you're always saying, we need more interpreters. We need more FTEs, full-time employees. Well, there's budget and there's all that, and you have to justify your existence, and you got to run your numbers, and you have to do all that. But instead of, hiring more, why not create more of a robust strategy so that we can attract that talent of bilingual providers and bilingual nurses? There's studies that show that that if you provide care in the same language and the same culture, it can really improve outcomes tremendously. So I really want to take all that to the next level. It only makes sense. It incentivizes teammates because it helps them get better pay, and it enhances the care experience, and it takes more of that burden off of the language access team. So that's my big, bold goal for 2021.
Well, it's a bold one, and if you'll permit me, Vonessa, actually it segues into one of my major efforts for 2021, and that's building the ALC Bridge, which is this platform that brings together the academics and the educators for students, because so many universities still don't think, they think that if you study language, basically you'll be a teacher, punto final. And we all know that, you know, there's a lot more out there. And your point, Danilo, segues in perfectly. If we encourage our students that are just interested and passionate about language, they don't necessarily have to be interpreters or translators, but they can use their language in their careers. And so I would be all in to help you work on getting that word across.
Right now at Cambridge Health Alliance, we are piloting a program where interpreters who have experience as language coaches are tutoring providers who have taken a language proficiency assessment and achieved a borderline score. So we're trying to work with interpreters to help the providers achieve the level of proficiency they need to safely provide direct care in non-English languages. And we started with Portuguese and Spanish, which are our most requested languages, and we're getting some really good feedback from the clinicians and from the interpreters that are involved in this partnership. But my personal professional goal for this year is 85%. Just like Dr. Fauci, I want to achieve 85% interpreter vaccination and 85% interpreter certification, because herd immunity and herd certification is what's going to protect us in 2021.
Oh, awesome. That is a fantastic goal.
Oh, I want to unmute myself. I'm sorry, I'm not on the video, but wow, Vonessa, this is amazing. I love the certification, herd immunity. We absolutely need it. And actually kind of to reflect on a couple of comments that I see in the chat is that, like, oh no, we shouldn't train providers because they'll take away our job. It was a joke. We all know that as soon as providers will really start learning the language, they'll understand how hard interpreting is, and they will use more interpreters. And also by getting more of us certified, by having conversations with more leaders like you who are encouraging and certification and requiring it, we will make the others disappear. By the others, I mean hospitals that don't care about language access, companies who don't value interpreters or certified interpreters and offer them below minimum wage pay. So that's what our goal is, organization too. We want to showcase you who do things right, and we want to show the country over the next several months that there are many of you. It's not just Boston, it's not just Los Angeles or San Francisco. So thank you for saying all this, and thank you for letting me interject.
You're always welcome, Natalia.
Thank you, Natalia.
Yeah, thank you. And Winchester, Virginia, we have the Valley Healthcare System here. You got to come, Vonessa and Danilo, and get them going. I think they have some sort of a language service. I don't know. But I think that the big picture is that language is so needed at all the different levels. And I don't think we need to be afraid of, you know, the provider, the nurse, taking the place of the interpreter. But if the nurse can communicate directly in language, tanto mejor, all the better, right? So that's the message that we're trying to make sure the audience hears. First of all, they got to hear that there's language, and then, you know,
I agree with Danilo wholeheartedly. Language access needs to be part of the institutional structure in healthcare. It needs to be available not just at all points of care, but at all points of contact. And so we absolutely need more bilinguals and more qualified multilingual people in every discipline, at every level of the organization.
And I think it goes, Vonessa and Danilo and Kathleen, with also the whole thing about diversity and inclusion, right? It really is, being able to take care of patients and greeting them in their own language, but also being able to look like the patients, right? So let's get the faces highlighted of the people that can provide care and look like the patients, because that's a true representation of a good service, right? And I think that it really provides a lot of opportunities for, again, highlighting the gift of language, but being able to also maybe a career ladder for those that perhaps do want to pursue healthcare interpreting as a profession and be able to get paid accordingly. So that's just neat. So I love the percentages, Vonessa. So thanks for being so.
We can do this.
Yeah, we could definitely do this. You have to go on the road also, then, Vonessa.
I want to go in idle.
And let's go together.
The quartet.
Hoping 2021 allows more on-site opportunities so we can hug each other. And you remember, Kathleen, the CCHI meetings, the commissioner meetings are so much fun. And last year we missed out on all of them, but can't wait until we get that opportunity again. Then we can really ramp up forces.
Have fun again. So on this issue of language access, the education and the nurturing of our heritage speakers is so essential also. Because I see families, I mean, I'm in restaurants and I see families and the children are speaking only in English to the Spanish-speaking parents, and I'm going, oh no, you're missing such richness. So there's work to be done there, helping them, the kids, people from coming and maintaining that second language. So yeah, lots of stuff. So professional goals, I mean, we've sort of crossed all across and into CCHI. I like your 85%. I was going to put a number on it. I was going to say I'd like to see 10,000 certified interpreters, certified CCHI interpreters. It's time. It's time. It's been a few years, Natalia. So get cracking.
And I think Kathleen, speak on behalf of CCHI. There's been phenomenal work, in 2020, despite all challenges, was a really good year for CCHI. As you know, being a non-for-profit can be tough, but interpreters came forward and got certified. We got phenomenal response. We got great feedback, and we are listening and trying to make sure that we can do whatever we can to support them in their journey to be certified. We also see that, with anticipation of and the work that we're all doing to try to get our interpreters vaccinated, we anticipate that there will be more interest, and some of our testing stations have been opening up with all the protocols and all the safety measures to be able to provide a safe environment for interpreters to be certified when they have to go for the oral test. But we're here to listen, and we have so many things planned for 2021. And with that, I just want to invite everyone again to be able to provide their feedback. We get emails all the time. We cannot answer all the questions in this short session, obviously, but we have plans for webinars that we can, because this is a casual conversation, but a more structured way to be able to address some of the questions and invite some of the subject matter experts, the academia, people that can come and talk to the interpreters and answer those questions. So feel free to keep sending feedback, and Natalia is great about getting that information over to us, the commissioners, and to the board. So just wanted to kind of echo that, because I know there are a lot of questions for this conversation that we couldn't answer because of time.
Absolutely. And speaking of time, we're at time. It's incredible how rapidly this 30 minutes has gone by. But I've been given I guess if it was big time and I was on TV, I'd be saying it's in my ear. My producer was saying, it's time. So Natalia, thank you very much for this opportunity, bringing us together. I'm psyched, I'm inspired, and look forward to following Danilo and Italy and Vonessa, whatever road they go on.
Well, thank you. And I know it seems like we don't want to go over time. We want to keep it short and sweet, and we always have so much more to say. So we'll have more community conversations. We already have a wonderful team planned for February. February is the Black History Month, and we have wonderful interpreters of color who will, share their experiences, because some of us interpreters who are immigrants, we know our experience, but there is a richness to us. We're not just all white immigrants or all brown immigrants. We are a mix of people, as this country is. So we're looking forward to our February conversation. And also, I want to thank Danilo for joining us. You're the first from the community of supporters of people who care about certification. So thank you for taking the time out of your busy day. And
Thank you.
to
for the
everyone
opportunity.
on the webinar, have a wonderful rest of Friday, and we'll tune in February. Bye,
Get
everyone.
vaccinated, get certified.
Yes, get
Yay, get
vaccinated and
certified.
get certified. That should be our hashtag now. We'll make sure
And
to use it.
And Natalia, just encourage the audience also to follow us on social media. We have phenomenal information. Our social media experts are always posting, and the commissioners as well are sharing so much good information. So stay tuned and join us on Instagram, LinkedIn, and Facebook.
That's right.
Twitter
And
too.
I know you've seen pictures of vaccinated interpreters on our Facebook and Instagram. Please keep sending us pictures when you get your vaccine, because there are still parts of the country where vaccines are not available. Interpreters ask us, how can I tell my leadership that they should get vaccinated? Well, point to our social media so that they can see, like, across the country, interpreters are considered essential health workers and get vaccines, and they're getting the second doses. And so when they see that, let's say in areas like North Carolina, Minnesota, Massachusetts, they're getting vaccinated, then they will feel ashamed and they will vaccinate you too. So it's kind of lead by examples, as we always do. Anyway, thank you very much. Have a
Thank you.
wonderful Friday and the weekend.
All right.
Bye.
Thanks,
Bye.
guys. Bye.
Thank you. Bye.